Assalamu alaikum. I'm Dr. Mohammed Suhail Panawala, and you are welcome in the last talk in the long series of leadership levels. This is the last and final level of the leadership. We have journeyed through the levels of leadership from position level at level 1 to the relationship level at level 2 to the result level at level 3 and the people development level at level 4. Today we arrived at the highest stage of the leadership, level 5, which is the pinnacle. This is the level where leaders are respected not only for what they achieve or whom they develop, but for whom they are and what they represent. At leadership 5 level, they become themselves a leadership legacy. So, level 5 leadership is rare, but it is not. So, level 5 leadership, although it is rare, but we can recognize them is these are the leaders which are followed because of their reputation and example. Their influence extends beyond their immediate circle or organization. They shape the culture, they change the entire organizational culture, whether in the hospital or any other industry. They leave behind a lasting legacy which the people follow because of the values in the systems and the leaders which they have developed already in the system. So, level 5 leadership inspire not only their colleagues but also future generations. They are borderless, they are countryless. Even the leaders of level 5 from other country we are influenced. Their leadership becomes transformational and enduring. So they are legacy focused. They think beyond their tenure, building systems, develops the values that outlast them. Even they are not around, people remember that when they were there, they changed these values. They are very visionary. They set the direction not only for the today but for the future generations also, and make the future professional attitude different in their vision, and they accomplish them by implementing their goals. Influence beyond boundaries, what does it mean? Which I said before, they are countryless. Does it mean? It means they impact so many people that they reaches far across institutions, far across countries. So, but they have the moral authority. Their integrity and consistency make role models. They are very responsible. So, for example, there are many surgeons which may be at the level of leader 4. You can find it out. Although it is also rare, but you can find it out. But a world renowned surgeon who not only pioneered techniques but also built training programs which or research centers or mentorship courses that continue to shape the field of treatment even after their retirement, even after they have died. This continues. Leaders in, for example, leaders in orthopedics, which develop implants and new techniques of surgeries like uh, different pinhole surgeries like this. So also in nursing, you can take the example. They're a nursing leader who establish national standards for nursing education or advocates for professional growth and inspires thousands of nurses across the country and beyond the country also. So, a health minister or a quality leader who reforms the national patient safety program or policies and introducing accreditation systems that raises their standards. Even they leave the office, their legacy will be continued, and people follow them because of their uh, because of their protocols which have they formed. A hospital CEO who not only transforms their institution into a center of excellence but also build a culture of innovation and continuous improvement that survives leadership transitions. So their leadership legacy endures in every staff member and process and seen in the outcome of the patients. So this leadership is so much crucial that the leaders five ensure that the systems do not collapse when they step down. They not only inspire the future leaders, they create institutional resilience. So in the time of disturbance or in the tough times, the system survives and elevate the profession as a whole. Their contribution shifts from being individual success stories to becoming architects of culture and legacy. So, at this level, the question is no longer what did the leader achieve, but rather what has the leader left behind for others to build upon. Did they build the system which builds other systems, or they were only busy in achieving the outcomes? So, level 5 leadership is the pinnacle of influence. They are not influencing the small group of people or small group of team members. They're influencing beyond their job description and beyond their borders of the institution. It is rare, although difficult, and requires a lifetime of growth, service, and character. But when achieved, it transforms not only organization but the entire professions. In healthcare, level 5 leaders are those who impact transcends the standards into their position. The leaders who has vision, values and mentorship and it continues to shape the patient care, professional standards and institutional culture for generations. The highest calling of the leader is not simply to succeed, but to ensure that others will continue to succeed long after they are gone. So they form a legacy. So this series of lecture after the level 5 leadership level is finished. So inshallah in the future we will discuss other aspects of the leadership, their characters, their traits, their skills in the future inshallah. Thank you.